We're continuing our talk with the Minister for Health and Social Care, David Ashford, on this Sunday. I say that because obviously things can change. These are the questions we've had sent in over the week. My partner has had to wait over 2 months for the breast clinic as they only have one clinic a week. I turned up this morning with 5 other women and some waiting 90 minutes just to be told we can't get hold of the radiologist. So all appointments were cancelled, and it's likely appointments will take place next week, won't take place next week either. My partner and 3 children are possibly looking at 3 months before being seen. Surely this is unacceptable.
Well, if that's the case, it is unacceptable, to be perfectly frank, from my point of view. We have built up waiting lists because the clinics can't operate in the normal way, because the risk if COVID got into that clinic and got into those patients would be absolutely devastating. So they have had to operate in different ways, but I'm not aware of the clinic not taking place because they couldn't get hold of the radiologist. So I will have to have that investigated. But we do need to look at what we can do to bring down the waiting times. Rather frustratingly, in between the 2 lockdowns in January and the end of February, we were doing just that. We were putting on extra clinics. They were starting to catch up. And of course, it's knocked them for 6 again. We're limited in what support we can draw on from the UK because they've got their own problems and their cancer waiting lists and times are starting to go through the roof as well. So we are limited in what we can do, but we are certainly trying to bring those lists down. And as soon as we turn to normal, we will look to try and put additional clinics on again to do just that.
This comes up, of course, this next one about being able to move here. Apparently you responded by saying that the island's not completely closed. I remember that was a question we asked. When, though, people are coming over here for property or jobs, they can get in. So why can't the government make it easier for families, especially children, to see their other parents either here or in the UK?
Right, we've got to be very clear that the people who are allowed into the island are people who have commitments to do so. So it is people who, for instance, have purchased a property, people who have a long-term rent of a property, or people who have a confirmed long-term job offer. So those people, because we've got to get, this is one of the problems with this. It's a balance, as we've discussed before, Paul. It's around personal health, the protection of the NHS, but also the economy, which ultimately pays for the NHS. Let's not forget, if we devastate the economy, then there isn't going to be any funding for health and social care going forward in future years. So it's a balance between all those things, cultural, social as well, and it's very hard to do. But one of the points of the border policy is to limit the number of people coming in and out, because obviously the more numbers of people you have crossing the border, the more risk you carry of something going wrong, of infection in the community reoccurring. And so that's why we haven't yet moved to the friends and family phase. As the Chief Minister has previously said in the press conferences, we hope that as we move to the end of this month, into the early part of May, we will be able to look at that and moving to the next part of level 3, which would allow friends and family to be sponsored in. We realise there's been huge amounts of pressure for over the last 12 months, particularly those that might have a parent in the United Kingdom that isn't on Ireland for children and so on. But it has been a necessary part of our restrictions, and I think it has helped form a protective bubble around the island in many respects.
You're not going to please anyone. That's one of those things that will come up constantly, isn't it? Because people do want to see their family and friends, and that's just going to go on.
Yeah, it's exceptionally frustrating for people. I mean, people have been 12 months now. I mean, I've got family down in Wales that I haven't been able to go and see. I've got friends over in Merseyside that I haven't been able to see. It's frustrating. It's exceptionally frustrating for everyone. So I do understand why, how frustrated people would be. But it is important that we have those restrictions in place because they have protected the island. But as we move forward and we start moving back to more of a normal life, those are the things that will slowly relax.
Can you explain how teachers with small children and no childcare will be able to go to work on Monday when some nurseries are remaining closed until the 19th, as it's not viable to open just for key workers?
Yeah, well, not everyone will be able to return to work, to be perfectly frank, Paul. We recognise that, and if people have issues, then they should discuss that with their employer.
The current situation in regards to visit to the hospital, this is quite detailed. The person's allowed me to say it though. They've got a dying member of the family who was actually featured in the paper. Nan Winnie celebrated her 96th birthday and was on the front of the newspaper getting her COVID jab. Basically, it's this subject matter of only one person is allowed there, and they've got this terrible dilemma with all the family only having one member there, and they really think, it's end of life on this particular occasion. They're saying, can't there be more movement to allow the family to say goodbye?
Well, what they need to do is they need to, and I am aware of this particular case, is they need to speak with the ward and see what they can sort out. We've got to be very careful again at the current time with the restrictions in place. For end of life, I know the hospital has been very good at facilitating for more than one family member. They've been able to arrange with appropriate social distancing and PPE people to go and say their last goodbyes. I mean, something like this is horrendous in the best of times. But to be going through it at this time with the current restrictions in place is absolutely heartbreaking for families. But we have one hospital on the island. If COVID broke out within that hospital and we had a large infection, we would effectively be shutting down our health service. So we haven't got contingency like in the UK where they can shut a hospital down and transfer to another hospital down the road or bring staff in from other areas. So we have had to be a lot more restrictive and protective of the hospital here on Ireland than perhaps you would have seen in the UK. But end-of-life visits can definitely take place. I know end-of-life visits that have taken place with actual families.
So
but they need to engage with the hospital and with the ward on that.
Right. When can tattoo artists return? Will it be the 19th? Only they have very strict guidelines on hygiene already in place normally due to the trade. So as good as dentists, which are already open, they do seem to get missed off the list. They don't get mentioned.
They do because they're not classed as essential, Paul, and that's the issue. Dental care can be essential care, so that is one of the big differences. I appreciate the tattoo artists, that they have very exceptional hygiene standards in place. They have to, because the risks otherwise are quite dramatic for their clients. But anything that gets you into close proximity with someone, even with the use of PPE, is still quite a serious risk. So at the moment, we can't give a date. We hope that we'll be able to relax further ahead of the 19th. But, I can't give any guarantees on that because things, as we keep saying, change day to day and can change quite radically. So it really will depend upon what the data is saying to us over the coming days.
The Chief Minister was talking about possibly opening up again the bubble flights between the Isle of Man and Guernsey, but has he not thought that Guernsey is opening up to the rest of the UK and obviously to Jersey? That therefore can't necessarily be the case to have a bubble with Guernsey if they haven't got protection. You understand where we're going with this one?
Yeah, I do. And the other areas of the world have shown you can do that. So there is the possibility to do that because you can restrict it to people who are Guernsey residents, for instance. And Guernsey could equally restrict it to people who are Isle of Man resident. That if you're not resident, then you're not able to use the air bridge. But we have to recognise that as we start moving slowly back to normal, these are the things that will be considered. I think what the Chief Minister actually said was not that we were going to go down that route, but it would be something we would look at. And I think as restrictions ease, it's something we do have to look at because we do need to get our travel industry back to normal as well.
Should people be booking on their EasyJet flights then?
I wouldn't urge anyone to rush out and start thinking they're going on holiday, Paul. In fact, I would actually personally discourage people from going on holiday over the summer period this year. I think that at the moment the situation worldwide is still very precarious. We have to remember it is still a pandemic. So at the moment, I certainly wouldn't advise people to be rushing onto the website and clicking buy.
Okay, and finally, tying in, I suppose, slightly with that, can you guarantee that after the borders are loosened at the end of April, there'll be no more COVID lockdowns on the island ever, regardless of the fact that COVID will come back into our community as a result?
We would hope not. I can't say never. I'm going to be perfectly honest. But the exact same line both myself and the Chief Minister have used is we want this to be the last lockdown. The community over the last 12 months has been very patient. They've worked exceptionally hard, and we need to recognise that. And the thing is, we need to start getting back to normal life. So we don't want it to be another lockdown, but we don't know with new variants where we're going. We don't know if there's going to be vaccine-resistant variants, for instance. At the moment, it's looking encouraging with the vaccines that although they may not be as effective against some of the other variants, they still prevent serious illness or death. So we've just got to watch where things go. It would be very remiss of me to say never ever again. And I don't think people can make that promise because something new could emerge. But certainly, my point of view, I hope this is the last lockdown and that we never have to go through this as a community again.
We'll know when it's all over because we won't have any questions. We won't be doing the press conferences. That'll be the final sign-off, I'm guessing.
And I'll miss my Sundays doing this with you, Paul.
Well, thanks for doing it. And thank you to everyone that writes in because even though maybe some things you think have been covered, they do change. And as you can hear from David, he's always got a response, which is lovely to hear from you. I mean, you do come forward, and I've got to give you some props on that one because it's important, is it not, that you are there to answer the questions, not just you, but other people that hopefully would also come forward, maybe.
Yeah, I mean, I think communication's important. I've said that, and I live by it. I might not always have the answers, and I might not have the answers that people want to hear, but I think it is important that government engages, and as Minister for Health, I engage. And I think some of the questions people have come up with, if I look back over it all, have been absolutely excellent questions, to be perfectly honest.
Well, we'll be doing the same thing next week. And don't forget, questions, news@manx.net, or I'll try and pick them up from other sources as well if you send them in to me. And again, thank you, David, for your time.
Thank you, Paul.